2. Welcome back, WNST, Towson, Baltimore, and WNST.net, along with Baltimore Positive, Don Moeller. I'm Nestor, Senator Chris Van Hollen, segment 2 from State Fair in Catonsville, and Senator's so popular, I couldn't even finish my waffle.
I'm going to say, Nestor, it's certainly one of the biggest crowds. I mean, you've got some friends that have come in here this morning,
Well,
Senator.
it's great to see lots of friends, and I want to also thank some of the elected officials that we work with, because it really does require a teamwork here. And Tom Quirk is here from the council, and I want to thank him. And then we have 2 members of the House of Delegates, Eric Ebersol and Jessica Feldmark. So I want to thank them, because we work very closely with them on also, as you can imagine, there are lots of issues that are state, federal issues or federal, local issues. And Don knows this from his time as county executive and all his years in county government, that we got to work together to make it work for the people of the state.
Without a doubt. And these folks, not only, we know they love the chicken and waffles here at State Fair, but they're here because the senator's here. So the senator draws a crowd. Now, I have to tell you, Senator, we spare no expense here at Baltimore Positive on our research. So when we were digging, someone told us that you have to ask the senator about his summers during college, that evidently your summers were a little different than my summers.
Yeah, but my summer in college would make me unelectable. It would be a real problem for me.
So tell us about your summers in college.
Well, like you said, your summers would have made you unelectable, so I better not be talking about my summers in college. Here's what I will say. So I had a roommate in college who came from Bellingham, Washington State. And so I spent 2 summers going up to Alaska and working in fish processing plants. And I'll tell you, man, if you're hitchhiking up in Alaska, if you're working at fish processing, no one wants to pick you up. But that's how we got around.
You said they could smell you coming.
The first time we
went,
we literally landed at the Anchorage airport. We spent the night camped out in the woods. We didn't know where we were going. We hitchhiked to a place called Homer's Peninsula. This is Homer is on the end of a long spit.
This is the best part of the world. Is I can look this up as we do it, because I want to know where this is.
Homer's
I'm a traveler,
Spit.
So I like to know where these places.
Okay,
Homer's Spit, Alaska. It's a real place.
It's a real place.
And there's a campground.
That's what we did. We camped out in a tent for like a month.
Oh, my God. It's in a peninsula.
That's it. There you go.
You can walk to Russia from there.
You got it. Yeah. I mean, you can. You can. Well, hey, it's not.
I'm not making that seriously.
It's not far from Kodiak Island, which is the United
Russia,
States, which has the highest alcohol consumption in the United States, by the way, Kodiak Island. But
you forget Austin Powers. You are truly the international man of mystery.
It ain't bears after that island. They're Kodiak bears.
There are big Kodiak bears out there.
There are. All I know about Kodiak is bear.
So I worked there. We worked. They would. The first place we went, when you catch shrimp, you also catch a lot of junkfish. So literally, we'd be on either sides of a conveyor belt. The shrimp would be coming up the conveyor belt, and our job was to pick out all the junkfish that were caught. So then we moved to another place called Osmar's Ocean Specialty, where I got to drive the forklift. I got to ice the salmon. I ate more salmon for breakfast than I ever want to. I couldn't eat it for a long time. I'm back to liking it.
Does it taste the same here as it does there? I mean,
it was.
Is there something about eating it fresh?
There's something about eating it fresh, but when you eat it breakfast, lunch, and dinner, you don't want to eat it for a long time.
You've had enough
I will
fish
say that.
for a while.
But I bought a motorcycle while I was up there with my money, and we drove back to Washington State.
Born to be wild, man.
Five
easy pieces.
We had a good time. I also learned to play a pretty good poker game, which I imported to Annapolis,
I was
Maryland.
going to say, it was a pretty regular game down there, right?
We had a good game in Annapolis. I don't want to get anyone in trouble. But,
you could have Jack Nicholson in another life.
No, I don't know.
All right, so I want to take
Go
this
ahead.
is off the last segment, because during the break, very briefly, when everybody was coming up, I told you that my wife was a 9/11 first responder. My wife's a 30-year engineer at Verizon, New England Tel, all that. And she went as a single girl in 2001 down to 9/11, wore the mask for about an hour, took it off. She was there 5 days afterward. And then in 2014, my wife was diagnosed with a rare form of leukemia. And in 2015, once again, and has had her life saved twice on the bone marrow registry, and has spent 155 nights. We're Baltimore Positive. Talk about the Baltimore Positive things. Nothing more positive than Johns Hopkins, right? So, and we found out literally last September that we put 2 and 2 together when they were finally looking for the final people that they haven't found. My wife was one of those people, and then we had to deduce. To see what my wife's gone through over the last 10 months and really over the last 5 years, and to see Jon Stewart come in there in front of all of you, and to think somehow they were trying to screw my wife on this. I mean, I'll give you an example. My wife spent $5,000 getting braces 15 years ago to fix her teeth. Now she's had cancer twice. Her teeth she needs braces again. It's $5,000 more, and the government doesn't want you know. It's kind of incredible to me that anybody could vote against that. And if I run into Rand Paul, I'm going to say to him, really. If I run into him at a U2 concert or something, because I can't believe that even made its way into the public eye, to the fact that my wife had to kind of come out of the closet and say, yeah, I'm one of them. Because we didn't really want to go down that road until we had to get a shovel and say, you're going to take my wife's health insurance away after she went to 9/11 and almost died twice? It's incomprehensible to me, Senator. It really is.
Well, I agree with you. I don't know how anyone can sort of look themselves in the mirror after not supporting.
But that's not bipartisan.
The folks. These are the folks like your wife who went running into these burning buildings, put their lives at risk. Many people lost their lives. Others have permanent injuries from reaching out to their fellow citizens and trying to save them. And the very least we can do is to make sure that we address all their health care needs for the rest of their life when they were putting their lives on the line. So I'm glad we got this done. It should have been done faster. The House passed it very quickly. There was a moment when it wasn't clear Mitch McConnell was going to bring up this bill. Then all sorts of pressure came down. As you said, in the end, we had an overwhelming bipartisan vote, but we did have some people who just did not vote.
My wife wakes up every day with $10,000 glass prosthetics in her eyes that hydrate her eyeballs because her eyes are like sandpaper in the aftermath of 2 battles of chemo. And to think that was brought on by being a patriot and going to 9/11, and that anybody, it's
inexcusable.
It is.
I should also say that one of the big fights we had just a few years ago was to save the Affordable Care Act, which is a really important health insurance source for tens of millions of Americans. And I can tell you, if you get rid of that, and they're still trying, the Trump administration is still trying now through the courts, you will deny not just the folks who get their health care through these exchanges, but anybody who has a pre-existing health condition will lose their protections, whether they have private health insurance or they get their health insurance through the exchange. Because one of the things we did in that bill was say that insurance companies cannot discriminate against your wife or anybody else who has a pre-existing health condition, because otherwise they just jack up the prices.
Well, my wife was fighting for her life. MetLife was trying to pull all of her disability, force her back to work before she even had eyes and could see. And I witnessed all of this. And then after we found out the 9/11 part, and then the government came forward. So this is going to be a battle the rest of our lives where the money is going to come for the people, either through the drug companies or through insurance in some way that the government needs to stand as a wall for us. I mean,
they do. And you mentioned the drug companies. I mean, this is an area where we've got to get something done because prices are skyrocketing. Look, it doesn't do you any good if you have a life-saving treatment and you can't afford it, right? So, in fact, I just introduced a piece of legislation with Rick Scott. He's a Republican senator from Florida. And here's the idea behind this legislation. We as taxpayers, we spend $38 billion a year investing in medical research. This is a really good investment for America, right? This is at places like the National Institutes of Health in Maryland. They do great work.
Save lives like my wife's life.
That's exactly right. They do the research that leads to treatments and cures that help save people's lives. But what happens is we as taxpayers make that important investment, but then a lot of drug companies take the fruits of that labor. They get the discoveries, and then they use them to produce a drug, and then they charge consumers these unaffordable prices, these huge prices. So what our bill says is, hey, if the taxpayers are making a big investment, taxpayers get a say in what the price of this thing will be. After all, you wouldn't have been able to produce this drug if it hadn't been for the help of the taxpayers, who are also the consumers and the patients. So we just introduced this. We're going to push really hard to get it done, but there are lots of things. I mean, the government should have the right to negotiate, of course, drug prices. We should allow reimportation from other countries. It's the same drug made here. It sells at, 1/5 or sometimes 1/20th the price other places. So this all goes to a broken healthcare system.
My wife's also diabetic and has been since she was 19. And insulin, the price of insulin is something we really monitor in our house.
Insulin is a great example of out-of-control prices, right? This is a drug that's been on the market for a long time, and there's no reason the price should be going up, up, up like it is. So,
well, you used the example, Senator, when you introduced this legislation to control prescription drug prices. One of the things that caught my attention was that the government had invested, one example that you used was $200 million in this cancer drug, Novartis. We had $200 million of government infusion for the research for that drug. And then when the company brought it to market, one infusion of that drug was $475,000. I mean, I read that correctly?
Yeah, that's exactly right.
$1,000.
$475,000.
I thought you were going to say $475.
No, $475,000 for a treatment. This is a CAR T. This is a good new breakthrough drug. That is why the NIH spent a lot of money put into research into cures for this kind of disease. And so with the $200 million investment, a lot of places did that research, but then the drug companies come in, they snatch the research, and they charge unaffordable prices. So what this bill does is say, we're not going to do that anymore, right? Taxpayers put in the money at the beginning, so taxpayers should not be price gouged at the other end of the process. And we're going to push really hard. And this is a bipartisan bill. It's a pretty far-reaching bill. This is the first time anyone's taken this approach. We need to attack this from every side.
Well, I think it's funny. We always say on Baltimore Positive, it's never a straight line. So we go from that to the larger issue of health care. And you and I have had a lot of discussions over the years about health care. You've been a leader on that issue, among others. You certainly, both all the way back to the General Assembly and then up through Congress, have been a leader on budgetary matters. I mean, you're sort of like the budget guy. You're one of the budget guys that people identify. So help our listeners understand again where we need to go in the United States with health care. We've got this huge debate now on the Democratic stage, whether it's Medicare for all or whether it's some variation or whether it's improving Obamacare. Recollection tells me that you've been a public option guy.
Yeah.
Am I right in recalling that?
Yes. My view is that we can get to a Medicare all type system, but it makes the most sense to take this in steps, and we can move as quickly as the system allows us to move. But step number one is having a public option within the Affordable Care Act. What does that mean? It means having a Medicare type choice that you can buy into through the Affordable Care Act. I pushed for this back at the time of the Affordable Care Act. We were not able to get the votes, even in a Democratic majority House and Senate, for the public option at that time. But what it would do is immediately create competition in every market, because one of the challenges in some markets around the country, you have only one insurer, and therefore, they can jack up the prices. So this allows for a Medicare type all option. You can buy in, and then you can see that you could expand that. I mean, you can expand that, and if people want to move in that area, they can do that. We have a lot of inefficiencies in our healthcare system, right? We spend 18% of our gross national product. We are not getting the results that you would expect from that if you look at our compared to other countries. So we need to do a whole lot better.
It was a Democratic talking point in one of the debates. I don't know which one it was. I don't even know who it was associated with. But the concept that we have in this country over the last 100 years tied your insurance to your employer. We've made it your employer's responsibility. That maybe that's sort of the original sin in all of this, that if the government got involved and the people could choose, it would make it easier. I employ people. I mean, Evan we employ people. That's one of the hardest burdens for an employer is tying that together. And a kid from Dundalk in the 90s trying to build a radio, it was always something that was so exorbitant that it would have made it difficult for me to stay in business, to do it as well as my heart wanted to do it as an employer. What I wanted for my employees, my friends, my loved ones is unaffordable as a small business owner in America in this century. It has been for me, and I'm one of them.
Right, and so that is, as you say, the original the challenge we're dealing with in this country, because we evolved a healthcare system where, as you said, employers were mainly responsible. Obviously, that didn't work for older people, which is why we started Medicare in the first place, right? People, they left their jobs. They no longer have coverage. You're 65 and up. That's why we had Medicare, because the private market couldn't take care of it. Now we want to, and that's why you have Medicaid for people who just don't have the income that allows, they may work for an employer who can't afford health care or refuse to provide it. So I'm for transitioning to a system where the burden is not on the employer. I just want to make sure that we do it by choice and in a way that doesn't undermine people who have negotiated, a lot of labor unions, for example, who have negotiated good healthcare policies with their employers and are scared about transitioning away and losing that. So
my wife is one of those people at the same company, 30 years, insulin dependent, survive every day. She
would be nervous with a plan that took away her health care.
Anything that would mess up her employment status could end her life.
So let's move in that direction. You can do it in a transition, and that where people are entering it through choice primarily, right? And I do believe that at the end of the day, we'd be better off if we didn't have a system where most of the burden for healthcare was on the employer. Think about it. If employers did not have to carry that burden and expense, you would say that, okay, they're going to
employ more people,
and you can increase people's pay, right? I mean, if you're not having to spend that money on healthcare, maybe you can give people a raise. I mean, that's what most economists would tell you would happen. Who knows? But
that creates a better society. We need to fulfill that sentence and say just more money. More money means everybody's happier, nobody's stealing, and there's all of those barometers that. When we talk about $15, when we talk about those things, it is a burden on the employer. But I've been to places where everybody makes a living, and it's a much more pleasant place to walk down the street.
Sure, and you don't want job lock, right? If somebody wants to leave their job and find another, another job, then you don't want them saying, I can't do it because I don't know what I'm going to do with my health care, right? So if we transition away from the employer-based system, that's a good thing. We just need to do it in a smart way.